Let's now go to front collecting points, or the move points, or the alarm points. Today we will talk about RAN 17, chest center, Tanchong. RAN 17 is located on the anterior midline on the level of the fourth intercostal space. How to find RAN 17? So using the quick method, especially in men, we locate RAN 17 on the sternum between the two nipples. For a more detailed orientation on the intercostal region, first we have to locate the manubriosternal synchondrosis, which can be felt on the sternum as a well-defined horizontal bone structure on the level of the costal cartilage of the second rib. The second intercostal space is below it. From there, count in an inferior direction to the fourth intercostal space. Locate RAN 17 on this level, on the midline of the sternum. Located on the same level in the fourth ICS are kidney 23, stomach 17, pericardium 1, spleen 18, gallbladder 22, and gallbladder 23. Two-tsun lateral to the midline on the nipple, one-tsun lateral to the nipple, or six-tsun lateral to the midline on the axillary line, one-tsun anterior to the gallbladder 22. Needling, depending on indication, 0.5 to 1-tsun transversely or subcutaneously in a superior or inferior direction or towards the nipples for mammillary disorders. Caution, intracardiac needling, pneumothorax. The sternum can be very thin in this area owing to embryonic ossification disorders. Moxibustion is recommended to tonify the chi, but used with caution on asthmatic patients. Actions or indications: RAN 17 regulates and benefits the chi, unbinds the chest, descends counterflow, lung and stomach chi. Benefits the breasts. Special features: RAN 17 is the front move point of the pericardium, meeting point with the spleen, kidney, small intestine, and triple burner channels. This is also the Hui meeting point of the chi, C of chi, and an important point for respiratory disorders. RAN 17 is a very important point to tonify the chi. It is both the gathering point for the chi and the point of the C of chi. RAN 17 tonifies chi of the chest and the gathering chi or zong chi, which is related to heart and lungs. Thus, this point is used to tonify chi, but only in relation to lung chi, not so much the spleen or kidney chi. If the chi deficiency is due to weakness of the stomach or spleen, this point alone would not be enough to tonify chi, but we have to use other points like stomach 36, RAN 12, and RAN 6. Besides tonifying chi, RAN 17 also moves the chi and eliminates chi stagnation in the chest. It is therefore used in any condition of chi stagnation in the chest with symptoms like feeling of constriction, tightness, oppression, or pain in the chest. RAN 17 dispels fullness from the chest, promotes descending of lung chi, and helps breathing. It is therefore used for breathlessness from any origin, whether it is from lung chi or heart chi deficiency or from obstruction of the chest by phlegm. RAN 17 benefits the breasts and can be used to treat insufficient lactation, both from deficiency of chi and blood and from chi stagnation. When used for the breasts, RAN 17 is inserted towards the affected breast. When used for chi, it is inserted horizontally downwards. summary of functions. Ren 17 tonifies the qi, strengthens the gathering qi, which is manifested as weak voice, tiredness, propensity to catching colds, spontaneous sweating. Ren 17 opens the chest, regulates qi, and promotes descending of qi, manifested as chest pain, wheezing, breathlessness, cough, fullness, and oppression of the chest. Ren 17 benefits the breasts and promotes lactation. So insufficient lactation, breast abscess, breast distension. According to the spiritual pivot, Ren 17 is the sea of qi, linking with Du 14, Du 15, and stomach 9. This passage states, when the sea of qi is in excess, there is fullness in the chest, urgent breathing, and a red complexion. When the sea of qi is deficient, there is scanty energy, insufficient for speech. These indications reflect the ability of Ren 17 to regulate qi in the chest, as well as to treat breathlessness with inability to speak. The spiritual pivot says that the gathering qi accumulates in the upper qi, with its lower pathway flowing down to stomach 30 and its upper pathway entering the respiratory passages. Located in the center of the chest, Ren 17 has a strong effect on the gathering qi, which in turn oversees both the lung functions of dominating qi and controlling respiration and speech, and the heart function of governing blood and blood vessels. According to the illustrated supplement to the Classic of Categories, Ren 17 can treat all types of uprising qi and dyspnea. When the lung fails to descend qi and control respiration, whether due to attack by exterior pathogens or to interior disharmony, there will be various manifestations of accumulation or rebellion of qi, like cough, dyspnea, wheezing, asthma, and fullness and oppression of the chest. Ren 17 is an important local point to relieve such accumulation of qi in the chest and to descend rebellion of lung qi. When gathering qi is deficient, then both lung and heart qi will be deficient. In the lung, there will be shortness of breath, whilst if the heart qi fails to move the blood and the blood vessels in the chest, there will be chest painful obstruction and pain of the heart and chest with fullness and oppression. Ren 17 is one of the primary points to regulate the gathering qi. The action of Ren 17 on descending rebellion of qi extends to the middle jaw, and it restores harmony to the stomach in difficult ingestion, acid regurgitation, esophageal constriction, and vomiting. Located midway between the breasts, Ren 17 is a principal point in the treatment of insufficient lactation. According to Observations of Women by Zhang Qingyue, qi and blood in the conception and penetrating vessels in women transforms into menstrual blood when it descends, and into milk when it ascends. Delayed or insufficient production of milk after delivery is due to qi and blood deficiency. Whilst the book Literatis Care of Parents states, sobbing, crying, grief, anger, or depression lead to obstruction of the milk passage. These two quotations illustrate the two main patterns underlying insufficient lactation, namely deficiency of qi and blood and qi stagnation. In either case, Ren 17 may be used in combination with other suitable points and is frequently found in combination with SI1 in classical combinations. Similarly, Ren 17 is often used clinically in the treatment of distension and pain of the breast and breast abscess. When any of these breast disorders is unilateral, the needle at Ren 17 may be directed towards the affected side to induce qi sensation into the breast, whilst if the disorder is bilateral, the needle may be directed first to one side and then to the other. Thank you for your attention.